This video is part 2 of my coverage of Matchstick Men, Ridley Scott film. It came out in 2003. In part 2, I'm going to be talking about specifically the elements of the film and the reflection questions that I asked you to work with as you were watching. So the first question that I asked you was to think about the behaviors that the character Roy exhibits that indicate that he may have some kind of psychological disorder. And the writers, they're working with a script that they developed after reading Eric Garcia's book. And in the book, the emphasis is on the obsessive compulsive elements. So you see what the writers of the film have emphasized is a pretty standard version of obsessive compulsive disorder. And by standard version, I mean what viewers are going to be accustomed to seeing in association with OCD characters. So you have cleanliness. He's shown cleaning after he's been stressed out, he's been triggered. He comes home, puts on his gray sweatsuit, and just really goes on a cleaning binge without being able to control it. He's also shown, being meticulous about the carpet, and when his partner, just intentionally gets dirt on the carpet, it makes him, physically become overwrought. He also shows some other kinds of attributes that we'll later kind of come to conclude are Tourette's-like tics. Another element that you see is something that leads you as the viewer to presume that he has some agoraphobia features, meaning you see it when the blinds are opened and the light floods in and he is triggered by that. But you have also some odd elements of his character where he shows this kind of behavioral restrictiveness. So, eating a lot of tuna, this very monochromatic lifestyle in his home and in his food choices. Those last two are they're not typical characterizations of OCD. Now, I also asked you, a thought question, not a question with a right or wrong answer, how accurate do you believe the portrayal is? And, as I looked at the article that I went through in part 1 of this video lecture, I also looked at Dr. Joyce Almeida's blog post on this film that was published in her Minds on Film blog. She notes that there are several ways in which the film shows you accurate elements of OCD. The fact that he has panic episodes where he's shown for comedic effect breathing into a paper bag. It is true that people with OCD, when they are triggered, when they're struggling with their symptoms in an immediate sense, panic episodes can occur. So that's something it's useful to see if you're trying to get an accurate depiction. However, when he's in these panic moments, it's typically for comedic effect from the audience standpoint. So it's positive in the sense that you have some accurate elements to what you're being shown. And kudos to Nicolas Cage for being able to pull that off, especially with the addition of the tic features of the disorder. At the same time, though, you do have some pretty stereotypical tropes being brought in here. You have he becomes enraged when he can't get his medication in a very unpredictable and scary way. You have him when he's in the presence of his quote-unquote daughter, he becomes much more relaxed. He becomes more at ease, more quote-unquote normal. And that's a problematic insertion. So he becomes more functional, more capable when he's in her presence. And you may have noticed, you may not, whenever he's in scenes with her, the color scheme gets brighter and more vivid, more interesting, less monochromatic. Now, the issue of medications does become complicated, and sorry for repeating the Nicolas Cage rage face on 2 slides in a row, but it relates to this issue of medication. In OCD films, medication is a complicated theme or sub-theme, as is the case in many other films that include characters with mental illness. There's always this sort of tug and pull, this difficulty with the person trying to decide, are medications useful, are they not useful, are they making me better, or are they not? That is evident within this film, as it is with many others. At the same time, though, the medication issue becomes a plot point in this film. And unfortunately, the only real therapy that the character Roy is depicted seeking out is medication. You're not told what medication. You're not really shown that Roy even understands what medication he's taking. And his only use for the mental health professional that he's looking for is to get a prescription for medication. Now, I've mentioned in part 1 of the video lecture for this film that the gold standard treatment for OCD is cognitive behavioral therapy with exposure response prevention. And that's designed to reduce the obsessive thinking and to limit the exhibition of compulsive patterns of behavior that interfere with functioning. Medication can be very useful, and I'll leave it to those of you who have disorder cards for this film to talk about those treatment approaches. But medications can be useful especially in terms of reducing the intensity of obsessive thinking. OCD is quite often comorbid with depression and anxiety, and the medications can be effective in managing those comorbid conditions. So in addition to OCD, what you should have been able to pick up on were the facial tics, and in some cases vocal tics, which are suggestive of the character Roy living also with Tourette's disorder, or Tourette's syndrome, as it's also called. Now, again, I don't want to steal the thunder of whoever has the Tourette's disorder card, but just briefly, people with Tourette's, if they are diagnosed with Tourette's, most also have, so a high percentage of people who have a diagnosis with Tourette's also have a diagnosis with OCD. Estimates vary. In some studies, about 60%. Some estimates as high as 70% of people with a Tourette's diagnosis also have a diagnosis with OCD or a related condition. The reverse is not true. So the majority of people with OCD do not have Tourette's or any tic-related condition. So the genetics here are complicated. There appear to be some intersections of the genetic predictors for Tourette's and the genetic predictors for OCD. OCD, though, is far more common than Tourette's. Therefore, it's not surprising that the majority of people with an OCD diagnosis do not have a diagnosis simultaneously with Tourette's. Now, as far as Nicolas Cage's presentation, he is one of those very physical actors. He uses his face in very inventive and creative ways for comedy, as well as, in other films for other purposes. The film, though, one of the thematic elements in the movie that is problematic, and I've seen this in many other OCD films, you have a character who's presented as having moral flaws, and sometimes personality flaws. So in a film like As Good as It Gets, in the TV series Monk, you have a person who is, really self-focused and egotistical and insensitive. Now in Roy, he's not egotistical and insensitive, but he is morally compromised. He's a criminal. He steals from people and lies, and he lives by his own particular code, but he is a criminal. So the story arc suggests to you as the viewer that his problems, his OCD, his tics, his panic episodes, they're connected somehow in the viewer's mind, thematically and otherwise, to the fact that he doesn't have family, that he's lost his family, or from his being caused by his criminality. So that raises the possibility for you as the viewer that what would happen if he changed these things? So what would happen if he isn't a criminal? Even if you're making the kindest assumption that if he stops being a criminal, he'll be less stressed and less likely to get into the kinds of trouble that he's shown getting into in the film. In As Good as It Gets, the Jack Nicholson film, you have a man, Melvin, who is rude and inappropriate, insensitive, manipulative, abusive. He is an all-around ugly human being, but he needs this order in his life. And the waitress that he falls in love with, she is a part of that orderly system. Now, in order for him to have some happiness, he kind of sees the waitress as the key to his happiness. He has to stop being the jerk that he is. He has to open himself up to being connected to other people. He has to stop being such a racist and a homophobe. He has to be nice to the dog, and so on. So many of these films do use this thematic device of saying, essentially to you, the viewer, if he lets go of these bad parts of who he is, if he stops being a bad person, his symptoms will be better. This is kind of like this cosmic balancing issue where you have a person who's behaving badly gets bad karma, and the bad karma is in the form of OCD. Well, people don't get OCD from being bad people. You can be a horrible person and have OCD. You can be an absolutely lovely human being and have OCD. It's an equal opportunity kind of disorder. And it's not caused by trauma. So the way TV and film tends to present it to you, though, is that OCD is a consequence of bad actions, or it's a consequence of trauma, which is the case in the TV series Monk, that his symptoms, they were present, but they were way exacerbated by the fact that he's a witness to his own wife's murder. Now, the image of the psychiatrist and the blog that I was mentioning earlier in both part 1 and 2 of the lecture, she notes this, that it's very problematic to present, even though you figure out at some point in the film that he's a fake psychiatrist. I still have many students who watch this film and think, hey, are placebos a real thing? Is that something a real psychologist or psychiatrist would do? No, that would not be ethical to do that in a treatment setting with a person with a psychiatric disorder. In general, it's not appropriate ever for doctors, whether you're talking about medical doctors or psychologists, to do that without a patient knowing that that's what you're doing. There are times when placebos can in fact be clinically useful. However, it still remains ethically inappropriate to do what was depicted here. Kind of like what we saw in Silver Linings Playbook, when the psychiatrist is shown intentionally triggering Pat's delusions and hallucinations with the song. Doing that kind of manipulation and really putting other people at risk is unethical and inappropriate. for a therapist to do under any circumstances. So just in answer to the question, no, there would not be a case where giving a placebo would be seen as appropriate in a therapeutic context. Where you will see placebos is in clinical trials to test the safety and efficacy of medications, for example. If you were going to, just hypothetically, if a therapist was going to propose doing this, they would have to have the informed consent of their client to do it. Now I asked you, how would you describe Roy's mental status in the final scenes of the film? And I ask you, how accurate is this? One of the things that films do that's problematic, and it's the case in this film, although it's not the most egregious example that I've ever seen, they do tend to have these tidy little endings. So you have Roy, he's ditched his life as a con man and switched it for carpet sales, which is a kind of inside joke of its own, where, there's a notorious stereotype of carpet sales being a kind of con artist job anyway. So he's doing a legitimate job, he has this nice little home, he has a beautiful wife, and he's pregnant, or she's pregnant, and they're going to have a baby. So he moves into this nice little, working class life, and he has this confrontation with his not daughter, where, they have kind of an agreement that, what they experienced was in part their own fault for being conned themselves. Now, the question of accuracy, having a life change where you go from being someone who habitually does something bad, like being a con artist, giving up that lifestyle, and saying, I'm gonna go for the checkout girl, and I'm gonna have my nice life, and I'm gonna have kids, and I'm gonna be good. Now, they aren't completely dishonest. They aren't, the writers that is, aren't completely suggesting to you that by having this new life and not being a con man, he's perfect. He's completely fine. You are given that little tick of the eye at the very end, which shows that, the symptoms aren't completely gone. He continues to have some issues and some challenges. So in that case, they're being accurate. Still, though, they do what a lot of Hollywood writers do, which is convey to you as the viewer the message that he is much better now that he's in love. Now that he's not a criminal, he can have the things that a normal life offers, and that includes a tremendous reduction in his symptoms. So as I usually do, I ask you in your final reflection question to put the film on a scale from 1 to 10. Like most of the films in this class, there are positive elements of the film and there are negative elements of the film. There are some ways in which the depiction of OCD is on target and others where it's very much off target. As you think about this question, really hone in on the issue of why present him as a criminal and why present the resolution of his symptoms, or at least their lessening, as being connected to giving up a criminal lifestyle. And why have him punished? Why does he lose all his money? Why does the con man get conned? And so on. So I look forward to reading your reflections on this film. And that concludes part 1 of, or part 2 rather, of my coverage of Matchstick Men.